West Nile virus has been found in Oklahoma County, and in studio this morning it's Kendra Doherty with the State Health Department to walk us through what we should do now to protect ourselves. Good morning, and thanks so much for coming on.
Good morning.
So talk to me about statewide. What are you all doing to track West Nile virus here?
So we have a couple different ways that we keep track of West Nile. One is mosquito testing. We've got many sites across the state that we collect mosquitoes and test them for West Nile virus. We also get reports for horses that are infected with West Nile from the Department of Agriculture. And then, of course, we track human cases.
Talk to me about the symptoms of West Nile virus. For our viewers at home, how can you know that you have it?
Well, it's kind of that normal febrile illness where you can have a fever, body aches, headache, but you can also have some stomach symptoms with vomiting or diarrhea or even a rash.
And how serious can those cases get?
There are occasional rare instances where there can be severe cases, and in those instances it might be a meningitis presentation or an encephalitis presentation, so very neurological in the way that those symptoms present.
So you talked about how the state is tracking West Nile. Can you talk about where mosquitoes thrive? Where can people find mosquitoes?
Yeah, in your backyard. You know, we are always talking about keeping all of those areas after rain or anywhere there's standing water. So even your pet bowls, you've got water dishes out for your pets. Like, make sure that you're changing the water out on a weekly basis at least. And if you've got rain like we're getting right now, try to make sure that anything that's collected rain is dumped out.
What can people do on top of that to even more so protect themselves?
Yeah, so you can do several different things to kind of protect yourself. So we talk about avoiding the most active times of the day for mosquitoes. So at dawn and dusk, you can wear clothing that's going to cover up the majority of your skin, or if that fails, or if you want to add an extra layer of protection, then you can also use some insect repellent like that has DEET in it.
Yeah, DEET is really important.
Yes.
I remember that from camp. They always said, bring your bug spray,
Yep.
make sure it has DEET because we will send you home if you don't have it.
Yep.
So last question here. If someone does come down with West Nile, what's the first thing that they should do?
Well, you know, the majority of people will not ever have symptoms if they are infected with West Nile. But if you do have symptoms, if you've got those severe symptoms, the really severe headache or symptoms that you're concerned about could be meningitis, those are ones that you could definitely seek care from a healthcare provider, and they can walk you through testing and any supportive care.
Is there anywhere on the State Health Department's website where people can find more information about West Nile and how you all are tracking it? See if it's in their neighborhood even.
We can add that to the website, a report if there is an active season.
Okay.
Typically, we only kind of put that up there if we're seeing a really active season. So some seasons there's hardly any cases, and we wouldn't be able to share anything except just a single number because of HIPAA and privacy concerns. So we do have a West Nile website with lots of different resources on ways that you can protect yourself.
Well, thank you so much for coming on and talking about this really important topic. I know a lot of our viewers, they really need to hear this information, keep them safe while we get into those warmer weather temperatures.
Yeah.
All right, we have more information up on KOCO.com. Go ahead and head over there. We'll be right back after this break.